Good evening. As lawmakers continue to work on passing the Trump administration's One Big Beautiful Bill, there is concerns over how it might impact New Mexico's healthcare system. News 13's Gabe Chavez spoke with state Medicaid officials and lawmakers and has a story.
It's a bill that has healthcare officials and patients concerned.
So the details of this bill may continue to change, but the harm from this bill remains the same.
The Trump administration's Big Beautiful Bill, in part, would bring some changes to Medicaid, including new requirements on who qualifies. It also changes provider tax rates, which impacts how much money doctors and hospitals can be paid through it. Medicaid officials say that 34% of the state is on Medicaid.
So up to $2.8 billion can be lost in Medicaid funding to New Mexico through this bill.
New Mexico is primarily rural, which has some hospitals around the state at risk of losing major funding and at risk of closing. They also say that 6 to 8 rural New Mexico hospitals could close in the first year of the bill going into effect.
So 14 counties being rural, 15 frontier. 11 out of our 33 counties are considered maternity care deserts today. So again, any cuts to our system as we see it would be less care and less access to care and less coverage for that.
Most of New Mexico is considered a healthcare desert, according to state officials. In many cases, people have to leave the state.
My health care for my bunch over here, most of it is out-of-state health care, especially if there's any specialist involved. We go to Texas, we go to Oklahoma, we go to Colorado, people in my district.
Well, this is concerning for the state's GOP. They believe some of the bill's overall changes, apart from the Medicaid, are necessary.
And we must realize to keep services that government has, you have to have taxpayers paying the bill.
Gabe Chavez, KRQE, News 13.
Lawmakers are trying to get the bill to the president's desk by July 4th.